Painful intercourse, also known as dyspareunia, is a common thing. Majority of the women experience this type of pain, but when it lingers, that is when it lasts for a longer time and it is frequent, you will not term it abnormal. And this pain could indicate a gynecological problems with your body's sexual response, or disinteresting sex. So, what are the causes of this painful intercourse in women? Although there are a lot of them, but I will mention few of them. Number one is vaginal atrophy. Atrophy simply means wasting of a body part. And this one is called vaginal atrophy, meaning wasting of the vaginal muscles. That is thinning of the vaginal muscles. And this vaginal atrophy is as a result of low estrogen level. When the estrogen level in the body is low, it can result to vaginal atrophy. And there are some conditions you can see this vaginal atrophy. Number one is perimenopausal. Then menopausal women, they always have low estrogen level. And when the estrogen level is low, the walls of the vagina, that is the linings of the vagina, will be less elastic and it will be dry, leading to painful intercourse. Next point is inadequate lubrication. When there is no stimulation before sexual intercourse, it can lead to decreased lubrication. And when there is decreased lubrication, the vagina will be dry, thereby causing painful intercourse. There are also conditions that can lead to this inadequate lubrication. Number one is after childbirth. When you are breastfeeding, even menopausal women experience inadequate lubrication. So it's advisable to always have a kind of foreplay before sexual intercourse in order to be well lubricated. Then pelvic inflammatory disease, known as PID. It is a severe infection of the reproductive system, the ovaries, the uterus, and the fallopian tube. And it could be as a result of untreated sexually transmitted infection. And when you have this PID, it causes an inflammation around the lower genital tract, thereby causing pain during sexual intercourse. Uterine prolapse is a condition whereby the uterus sinks, that is, protrude into the vaginal canal. This can cause discomfort during sexual intercourse. It makes it uncomfortable. It can even lead to lack of lubrication, thereby causing painful intercourse. Age is a risk factor of this uterine prolapse. It usually occurs in elderly women. The muscles are wasting, the ligaments, everything. So age is a risk factor of uterine prolapse. Too much vaginal delivery can as well lead to this uterine prolapse because the ligaments, muscles are getting weak. During delivery, you are stretching them. So when you have multiple cases, it can lead to this uterine prolapse. So uterine prolapse can lead to painful intercourse. Then we have vulvovaginitis, simply the inflammation of the vulva and the vagina. It could be as a result of fungal infection or any skin disease. Once this happens, it causes irritation around the vagina and the vulva, making sexual intercourse uncomfortable, and it can lead to painful intercourse as well. The next point is Vaginismus, an involuntary contraction of the pelvic floor muscles. It could be as a result of anxiety, infection, or past sexual abuse. And one thing about this condition is that it causes vulvar congestion, which can lead to inadequate genital arousal during sexual intercourse. And once there is inadequate genital arousal during sexual intercourse, it can lead to pain. The next point is genital injury. It could be a surgery, that is pelvic surgery, or FGM, that is female genital mutilation. Once this injury occurs, during healing process, they might heal with scar tissue formation. So during sexual intercourse, the muscles find it very difficult to stretch. So when you apply pressure during sexual intercourse, it will cause pain because they are not really stretching. They have reached their elastic limit, and that will result to painful intercourse. Some skin disorders as well, like eczema around the genital areas, can also lead to painful intercourse because they will cause a lot of irritation around the genital area. So once you have sexual intercourse with the irritations, it will lead to painful intercourse. Fibroid can as well cause painful sex, but it depends on the location and the size. When the size is too large, it puts pressure on the uterus. So during sexual intercourse, it will lead to pain. Coming to the location, when it's located at the cervix, that is the neck of the uterus, it makes penetrative sex very difficult and uncomfortable. Then the last but not the least is endometriosis, which simply means the growing of the endometrial linings outside the endometrium. That is when the endometrial lining grows outside the endometrium. It could be at the fallopian tubes or the ovaries. When this occurs, it can cause some lesions. And during sexual intercourse, these endometriotic lesions can stretch or pull, leading to painful sex. So let's discuss about the treatment options for this painful intercourse in women. The treatment depends on the cause of the painful sex. So once you are experiencing this pain, you should ask yourself what is really causing this pain so that you channel your treatment towards that area. Number one is counseling, especially in Vaginismus, that is caused by fear and past sexual experience. When you are being counseled properly, those experiences will no longer occur to you. You know how those fear, you will not be anxious again. So during sexual intercourse, you'll be relaxed and you enjoy it properly. Then we have topical estrogen vaginal cream. It's a cream that contains estrogen, especially for menopausal women and those that experience vaginal dryness. Once you apply it in your vagina, you no longer feel pain. It makes the vagina want to be thick, so you not experience pain during sexual intercourse. Then lubricants, especially water-based lubricants, they don't cause irritation around the vagina. So once you use this type of lubricants, you always feel lubricated and sexual intercourse will be very smooth and enjoyable. Antibiotics as well, those that are caused by infections, the pelvic inflammatory disease and Vaginitis. Once they are being treated, there's nothing like inflammation nor irritation. You will enjoy your sex, no cause for alarm. Then surgery. When it comes to fibroid, if it is too big and it's causing a lot of pain, you can opt in for surgery. It will be totally removed and you feel comfortable. That's just the overview of painful intercourse. So if you really enjoyed this video, kindly subscribe to my channel and hit the notification bell for more health updates.